Welcome to CHAS Behavioral Health Center. This behavioral health center is dedicated to primarily focus on behavioral health with wraparound services of some primary care screening, psychiatric consultant medication management, care navigation for case management services, peer support services as far as walking alongside the patient for the experience. This is a clinic that's based on a SAMHSA grant for a certified community behavioral health center, which is a model where patients receive wraparound services, kind of one-stop shopping as far as they get their behavioral health services, some primary care screening and referral as needed, substance use disorder services, peer support services. And if we're unable to serve them where they're needed, where they're at in that level, then we work with our community partners. So the second part of the model is strong community partnerships, collaborations, and signed agreements where we are referring patients and streamlining their care. So this is a pediatric behavioral health office where a behavioral health provider would meet with a youth or a child and their parents or caregivers. They would talk about and develop an individual service plan based on the individual needs of the patient and the family. And they would go and have different types of exercises and approaches on our evidence-based practices for the therapy that the patient needs. So this room serves a lot of different functions. We may have our psychiatric consultant come in after our behavioral health medical assistant does some vitals and some initial screening. Then our psychiatric consultant will come in and discuss medication management and their needs. We may also use this room for peer support services to meet with the patient and talk about their goals, what they might be struggling with, what they want to work on. We also have our behavioral health care navigators who meet with our patients to screen their needs, what they may need as far as referrals to the community, basic case management needs. So a variety of different services can happen in this room. This is an example of a pod space, we like to call it, where we have several different staff who are working in a pod space. This is not a patient-facing area, but it's where phone calls are made, collaboration is made, jumping on a virtual meeting, doing documentation, patient phone calls. So it's a great area for our providers to collaborate with one another and then use one of the exam rooms for the actual services with the patients. This is an example of one of our adult behavioral health rooms. So a behavioral health provider will come in and meet with their patient here in this space. They might use the whiteboard to do some work and some drawings and examples or lists of what they may be working on. Again, we use our behavioral health evidence-based practices to meet the patient and their needs and the different approaches that are customized for the patient. So this is where individual sessions happen. And then also our provider uses the space for phone calls, documentation, meetings, that kind of thing. We actually still have lab space. So this is again where our one-stop shopping model really works for our patients. A lot of our patients have transportation challenges. And so if they are here and they need to get a flu shot or a vaccine or may need to do a blood draw, they're able to do that right here under one roof. We're really excited to have this resource space for our patients. It's a unique space just off of our front lobby where patients can come in and meet again with a peer support specialist or a behavioral health care navigator to get some information, some resources, or simply it can be a room where they take a few minutes to do some mindfulness breathing as it was challenging to come to the visit today and to leave their home. And so it's an opportunity to center and to have some mindfulness time. Again, located right outside our adult front lobby, so they are able to step in and use the space when they need to. Now we are here in the training room here at our Behavioral Health Center. This training room can be used and is used for multiple groups, for patient groups. The tables and chairs are designed to roll because we can make this a space where we have a circle where we do some processing, or maybe we use some floor space and are able to do some breathing exercises. This room is also used for our multidisciplinary staffing room. It's a great room to, again, welcome our patients and for our staff to come together for our patients' needs. Well, thank you so much for joining us today. That wraps up our tour. So thank you for your time and letting us go through and talk about our wonderful behavioral health center. What we really enjoy about this program and this model is that so many providers are all working here together for the needs of the patient. They're able to help with their physical needs, mental health, substance use disorder, peer support services, case management, and referrals to the community. So patient is not alone and they have this wraparound support where we're able to meet their needs where they're at here today or meet them in the community where they need to be. So thank you so much.